You've done stories on your show about these medical spas. What do people need to look out for?
Make sure they have a real license. Ask them basic questions like, how many have you done? Can I talk to a patient that you've taken care of in the past? Show me evidence of what you've been able to accomplish. And then listen, trust your instincts. Believe it or not, you ask a couple of sophisticated questions about how they do it. If they can't answer it like this, they're not right for you.
Get out of there.
Get out of there. A doctor who is struggling to explain what they're about to do, you don't walk away, run away.
How pervasive is this problem?
It's much more pervasive than we think because it's completely unregulated. You know, as you have as well, we're now seeing these events take place in gas stations, where massive
gas stations,
mall, backyards of malls, parking lots, where women, because they want to look different than they look right now, are willing to let people do things to them. Probably somewhere in the back of their mind is a realization that there's a danger there. But it's not just Botox. It's not just this port. It's not the injections that we fear right now in this episode. It's other products, injectables, silicones, cements, because you're not supposed to put cement in the body, but that's what it looks like when you're done. And these disfigure these women terribly. And every time I do one of these shows, I'm left scratching my head and wondering, what else can we possibly do to awaken America that this activity, this criminal activity is taking place? Please, let's use your show as an opportunity to broadcast it widely. Be aware, warn people. And guess what? You catch someone doing this kind of stuff, call somebody. And get some allies in there, like law enforcement, because they'll shut these guys down like that.
Why is this the wild, wild west in some ways?
I think it's become the wild, wild west because many folks have access to these chemical tools, whether they're legitimate or not, sometimes to be disputed. People can buy needles in a drugstore. And when you have wide access to these types of products, you can create a fake clinic. Literally, on Fifth Avenue, I made a fake clinic once, and I put these ridiculous ads that we would laugh about if I showed them right now. And then I surprised women who had sat down in a chair, ready to get injected, eyes looking upwards with great joy and hope, only when I confronted them and asked them simple questions like, what kind of a discussion did you have? Was there even a consultation? That panic look that I got reflected the fact that they finally had the epiphany. Let's avoid that in the first place. In fact, speaking of consultations, any doctor worth their salt will sit with you for a few minutes and clearly outline exactly what they're going to do. One of the best tricks is don't get the procedure done that day. Check them out after you hear their voice.
The best advice you can give?
Number one most important advice is when you go into a medical clinic, ask a couple basic questions. Make sure they've got a medical license, have them show it to you, and double check that it's true afterwards. And always, always try to stall a tiny bit to understand exactly what's going on around you, because your instincts will usually be on target.
Dr. Oz, as always, thank you very much.
Thanks for what you're doing.
Appreciate your insight.